we have, since the beginning of the ERNs, we have 7 expert centers who belong to, who are members, full members of 5 of the ERNs. I'm not going to mention them, but it means that for more than 7 years already in Bulgaria, we have 7 expert centers who are very well acquainted what is going on. They have passed also, some of them recently, the monitoring process, the auditing process. So anyway, 7 are they in 5 ERNs. At the same time, Bulgaria was the only country with a 1 million population which didn't participate together with Malta and Luxembourg at the call for full membership, which was in 2019. In the Bulgaria didn't participate also to the call for affiliate membership, which was prior to the call for full members, meaning in 2019 again. I'm not going here to discuss the reasons, but anyway, it's of course related to political will, to challenges in the legislation, which actually our project, our initiative is also tackling. And it was the aim of the project. And what else? At the same time, we have endorsed by the national authority, since it is national competence, of course, the endorsement of national expert centers in particular rare diseases. We have over 25 expert centers, national expert centers. They don't cover all of the thematic areas at all. And these 7 ERN full members are part of these 25 centers. And the very newest one, since July 2000, since the recent July, is the first and only expert center authorized by the government in the rare eye diseases field, and it is the LHO's ERN center. Could we go to the next slide, the second one? So the objective of the project, the initiative, because our meeting is part of a bigger initiative which is led by initiated by Retina Bulgaria in a partnership where the initiative is participating also the Retinitis Pigmentosa Society from Norway. But anyway, the objective is that we are tackling the legislation. It is under program of the European Economic Area, only for NGOs and especially for civil societies, not for all kinds of NGOs, but exactly for citizens, for civil societies. The objective is to build consensus around the need for legislative changes and to promote also the ERNs. Actually, just for information, we have already published the legislative changes, and there will be a discussion very soon. To the preparation of these changes have participated actually the leaders of the expert centers, members of the ERNs, and all of the Bulgarian EPACs. We are 7 EPACs participating to the work of 7 of the ERNs. They are not the same anyway. The next slide. To go already, what's the landscape in the rare eye diseases field in terms of research and also from clinical perspective. As I said already, there is already authorized by the authorities expert center, meaning that if potentially there will be an a call from the European Commission for whatever membership, it will be the only one center which may apply for membership to the ERNI in our case. So what else? In terms of research, there is a history in Bulgaria already. Professor Kaneva is here. She is also a member of this center of the LHO's ERN center. What I said in terms of research, we have quite a lot, long history since probably there will be some words that after the presentations today related to research, especially in the field of the inherited retinal dystrophies. So there are also some new genes which have been described here. In terms of clinical work, there was also a history, but this clinical work wasn't related anyhow to genetic testing in the past. There is a quite new history in terms of linking between the clinical work and genetic work. And this work is dating from 2021, when Vertis has has initiated with the eye clinic at the University Hospital Alexandrovsk and the Medical University Sofia program for free genetic testing for IRDS. And under this program, from March 2021 till September till now, they have been around 350 patients were diagnosed, and 5 children with LCA were detected, and these children were treated afterwards in a hospital in Croatia, which is also which isn't a part of the ERNI as well. So could we go to the next slide? What actually would be good really if we could discuss today, since actually quite a lot of challenges are staying in front of us in terms of collaboration and promotion of best practices, and in terms of data sharing as well. So of course, we as patient advocates, we are interested how and who from the Bulgarian HCPs and the Bulgarian researchers who have already experience in ophthalmogenetics could be potentially, could really start a collaboration with the ERNs and a supporting partner. We will see afterwards the other speakers will touch the point related to the ERN integrations, because he's Professor Kaneva, who is in charge of it somehow with the medical university, pretty well acquainted with the situation, also part of the LHO and authorized expert center. She's also lead from Bulgarian side for the European Rare Disease Partnership. So I think that quite a lot of people are here today there are not too many people in Bulgaria who are engaged with exactly with the matter. The meeting is quite focused. So please, Hélène, the floor is yours, if possible, to present the ERNI.
Yeah, thank you. Do you hear me well? I will share my
we hear you very well.
Yeah, Professor Hélène Dollfus, probably will present yourself.
Yes, because, I just want to be sure you can see my screen.
Yes.
Can you see my slide? And do you see the second slide? Yes.
Yes.
Agenda. Okay, this is fine. So yeah, thank you very much, Petia. Thank you for all your energy, Petia, around rare eye diseases in your country and in Europe. You are doing a lot, and this is very nice to see people who are trying to move the lines all the time, and it takes a lot of energy. So thanks a lot. So I'm a professor of medical genetics and ophthalmology at the Strasbourg University Hospital. I run a research lab, and I also happen to be the coordinator of ERNI. So I think what I'm going to do is going to show you an example of what is an ERN, and take the example of ERNI, how we are moving forwards. So as you know, today there are 24 ERNs that were launched in 2017. And they cover more or less all the fields of the medical rare disease fields. I mean, really, I think with the 24, there are almost all fields of rare diseases that are covered, although there are still some rare diseases that have to be pinpointed, and this is an ongoing story. So it runs from rare bone diseases, rare kidney diseases, etc. And we are in charge of the rare eye diseases. So if we look globally at ERNs, the system is simple, at the same time very complex. So the ERNs were launched by the European Commission We are not a legal entity. And the members of the ERNs are healthcare providers, meaning hospitals. This is very, very important. It's not research laboratories that are members. It's really healthcare sites, hospitals, mostly university hospitals across Europe. So the ERNs are piloted by a management team that is located in one university hospital. For ERNI, the management team is located in the Strasbourg University Hospital, and there is a coordinator, and it's me. So we are functioning in the rare disease European ecosystem. First of all, our governance is really directed by the Board of Member States and the European Commission, and especially DG Santé. So we are really referring to these two entities, the Board of Member States that takes the decisions, and the DG Santé that is the executive arm of this big health program. Then there is also a very important partnership that is the patient, of course, because this program is patient-centered, and there has been a huge lobbying, for instance, ERNs for years and years before this program was launched. And of course, patients are active partners of the ERNs. Then we also navigate in a very complex ecosystem of various programs. Some are European driven, like the European Joint Programme for Rare Diseases, Orphanet, etc. All these programs are really linked to ERNs and also may help financing, for instance, some research projects. And of course, we have other very important partners that are very administrative and highly important for innovating in medicine. For instance, the European Medical Agency is, of course, a very important stakeholder, as an example for us. So the ERNs are navigating in a quite complex ecosystem. And the missions of the ERN is really to improve the care of patients with rare diseases. And we know it's very heterogeneous on the European soil. There are some countries with very organized rare disease plan, such as in France. I can take this example, we know it very well. And in other countries, it's much more recent and less organized. So I think there is a big endeavor to try and homogenize the care and leave no one behind in Europe with this program that is based actually on the cross-border directive of the European Union for transnational care in Europe. So what we are doing, all the ERNs, we're really trying to improve the management of the patients with the virtual tools, which is called the case patient management system, which is working more or less well, depending on the ERNs. We're trying to improve the patient pathways and to produce also knowledge with guidelines and webinars, etc. The education and trainings, and bringing in new experts to reinforce our teams and to create new teams. Why not? This is very important, and we have also a very important role to play on registries and on epidemiology. So the registry for rare diseases is a compulsory activity of all ERNs. And all ERNs are, of course, mostly invited and we really have to do research and to bring innovation to our patients. This is really highly awaited for the ERNs, although we do not receive directly money for this. So sorry, I tried to next. Yeah. So if I focus on the rare eye diseases, it's like other diseases like the kidney or the bone diseases or skin diseases. We have a lot of entities. I mean, for instance, for rare eye diseases, more than 900 different conditions. So it's a lot. Of sometimes it's a few patients, sometimes there are much more, like for retinitis pigmentosa. And we know that more than a third are syndromes, meaning that there is the eye and another organ that is affected. That means that we interact also with other ERNs, and this is very, very important. On the European point of view, probably genetic eye diseases has become one of the first cause of blindness for children and young adults in the EU. And another very common trait of rare diseases across the ERNs is that we still lack specific therapies for the majority of patients. We know for rare eye diseases, for instance, we have Luxturna for OP65. Petia mentioned this, but this is still an exception, and we hope this is going to change in the next years. So we have a number of missions that are the same as the other ERNs. I was mentioning to you the improvement of the patient care journey. And this is going to be enlarged in the next year with another very important program at the level of the European Commission to really try to bring the ERNs into, and also to try and reach out all the rare disease patients in every country. So it's a big program, and of course all our tools, especially the case patient management system, will be used. So this is in principle a virtual clinic where a doctor with a difficult case can upload a case, and then the panel of ERN experts can reply. So we really want to share this expertise with as many countries and colleagues as possible. So we also want, and that I will just touch this point here now, to improve the access to genetic testing. Petia was mentioning this. This is a big improvement, but it's also a challenge in a number of countries. In some countries, it's very well organized with first line access to genome on a national basis and reimbursed. In other countries, the opposite. There is no access. There's no reimbursement. So this is a very big a field of activity for the ERNs. Of course, we want also to improve the access of patients to clinical trials, and this is why also the registries are going to be very important to identify the patients. ERNI, just very briefly, we are 60 healthcare providers in 24 countries of Europe. So we have 20, what we call 52 full members in 18 countries and 8 affiliated partners in 6 countries. We are organized in a way where we are like a sort of virtual clinic with the working groups that address specific questions or subspecialties of ophthalmology. For instance, one group is dedicated to retinal genetic disorders. Another group is dedicated to anterior segment rare disorders. So we try to cover the whole field of rare eye diseases. And then we have transversal work groups with dedicated to low vision, for instance, and how to improve daily life of patients. Another one very important on genetic diagnosis, another one on registries and research. And as I just mentioned before, national integration is really one of the main objectives of all the ERNs in the next 4 years. We have been driving a lot of different activities, and for instance, one of the first activity that is continued actually is going to be continued in the next 4 years is how do we classify our conditions. So we work a lot with Orphanet. I suppose everybody knows about Orphanet, and also HPO, which is the human atlas for phenotypic treats. So we have key activities, and I will just spotlight just a few of these, because I know there's a lot of discussion to come. So I mentioned the case patient management system. It's like a virtual clinic, and this is online, and we're going to have a new tool that is going to be provided by the Commission. We would like this tool to be much more used. In some ERNs, it's a success. In other, it's more difficult. It's also very much based on the time that have our colleagues in the different hospitals, and also how much our colleagues ask in the other countries for some opinions. But we have also used the CPMS in another way. We organize ground rounds, which are called the GREET meetings, which are very popular, where we really address very specific clinical questions on very challenging cases, and this is very educational and also very challenging on clinical grounds. So we have this for the retina. We started with this with the retina, and now with pediatrics. On the other hand, we also developed online meeting on rare eye diseases variants, genetic variants, and for instance, for validating, for instance, RP65 variants for gene therapy. So this is called REDVAR, and is also a very popular meeting. We, as the other ERNs, we have designed a registry, a basic registry that is called RED registry, for Rare Eye Disease Registry, and we are developing another one, which is more, which will be more detailed on retinal dystrophy. So we have started, we have a first enrollment, we have still some improvements to do, but I hope this will be very soon accessible for all our members. And of course, what we want is that there is an interoperability with other programs. We are also very much committed to drive research. And just for an example, we have a research on how to evaluate the quality of life of poorly sighted children. So this is a program where we have 6 EU countries that are our members who are working on this questionnaire, on this qualitative and quantitative research. And we communicate a lot, either on training or education, but also we do a lot of webinars and educational tools for colleagues with various material, good practices, guides. Also, for instance, when there was the COVID outbreak, we were really giving some recommendations for the patients. And also, for instance, we have another tool where we explain how to better welcome a patient in a hospital, for instance, but we have newsletters, etc. So I will now give the floor to Dorothée for the last minutes on the ERNI governance. And Dorothée, tell me when you want the next slide. I will do it.
Thank you, Hélène. Hello, everybody. So I'm Dorothée Leroux, the ERNI project manager, and working daily with Hélène. To continue on the same line, next slide, sorry. I will present you the governance. So Hélène already presented you the organization of the working groups and transversal working groups. Each of them have chairs. So sometimes there are clinical staff, and sometimes it's patient representatives. All these chairs constitute the coordinating committee, and this coordinating committee meets monthly, mainly virtually, but organize it's the executive body and organize the decision and how we apply the decision. All the important decisions are made on the governance board. The governance board is constituted by one representative per member, by HCP, the full members, and one representative from the affiliated partners. And in this governance board, we also have two patient representatives from the Patient and Family Advisory Council. And of course, we have our coordinator, Hélène Dollfus, and all the project management team, which is here to serve the network. Next slide. All clinical working group chairs are presented here. They are all well known in the field. So for the first work group is Bart Leroux and Michael Larsen for the retinal rare eye diseases. The countries are well represented. For neuro-ophthalmology, it's Stefan Amann from Denmark and Catherine Vignal-Clermont from France. For pediatrics, Dominique Brémont-Gignac and Susanna Noval, and from anterior segment, Daniel Beringer and Petra Liskova. Next slide. For the transversal working groups, for low vision, it's Agnès Supiège from Italy and David Keegan from Ireland. For genetic diagnosis, Susan Cole in Germany and Elfried Deber in Belgium. For the registries, it's Christina Fasser, it's a patient representative, and for research, Katharina Stingel and Camille. Next slide. I talk about the patient representative groups, and you have all the members presented here. So you know Petia very well. We have also Dominique Sturz. Both of them are the current official representative at the governance board. But we have a representative from other countries. And we have supporting partners as well. And you will have Russell Wheeler that will present just after me. So you can ask him questions on the functioning of this board. Next slide. So we organize meeting basically for our governance. It's essential because we have the governance board during these annual meetings, and it's scientific meetings as well. Thank you very much, and that's all for me. I'm ready to answer every question.
Thank you, Dorothée. I just would like to mention, yes, I was in my talk, but of course, Dorothée is the project manager since 2017 of ERNI. So we have a big experience of what has been going on in the field, and we also have a team in Strasbourg with 6 people, not all full time, but who are working on ERNI. Yeah.
What I said also to the audience prior to the meeting is that Hélène was the coordinator for all of the ERNs during for a mandate for 1 year. It was last year. So she was the direct interface between the ERNs, to the European Commission, to the board of member states, between the EMA, between all of the important stakeholders. So we're very lucky in the rare eye disease field that we have somebody who is very well acquainted with the whole political research and clinical ecosystem in Europe dedicated to rare diseases. So
thanks.
Yeah, Russell, the floor is yours. My colleague Russell Wheeler, a patient advocate, very prominent one, also participating to different advisory bodies to the EMA. He's representing also the LHON Society UK, but it's among the very first patient advocates related to the ERNs and to the ERNI in particular. Please, Russell.
Hi, thank you. Can you share my slides, or shall I do it from here? It may be better if you do it. I think you have them, I saw in the folder.
Yeah, yes, Mr. Weaver. I can share the slide for you.
I only have the opening slide and then 4 more, and I will try to be quick so that everyone has time for questions at the end. I've shared my email address in that. If anyone has questions that you want to send by email, if you can go back, that's it. Sorry, the very first one, slide 1.
Yeah. This is Petia's slide.
I thought I saw it before. Okay, we'll edit. That's it. Yeah. Okay, great. Can everyone see it? I hope. So, as I say, I put my email address if anyone wants to ask any questions later, if there is no time today. This is very much a personal view based on my own experiences as an EPAG member of ERNI and my reflections on what's worked for me and what hasn't. ERNs are an incredible construct that have the potential, in my view, to totally transform the landscape for rare eye disease treatment in Europe. But they need our help and they need patient involvement. Actually, I was very impressed with Hélène's presentation. I would just make one small comment, and Hélène will not be surprised to hear me say it, that for registries, I always put it at the very top of the list. Everything ERNs do is important. Everything ERNs do is something we all want to support, but many things that ERNs do could happen and indeed do happen in other ways. I think ERNs make them better in all cases, but they could happen otherwise. Registries, for me, they are the lifeblood of rare disease going forward, and I see no other organization that can reasonably and sustainably curate registries for rare diseases. So for me, people ask me what is the point of an ERN. That's always my first answer, and I really have to emphasize that at all times. The next slide, please. So, as I say, this is a very personal kind of journey through the ERNs, and I'm guessing that this either right now or later will be seen by people who are considering becoming part of another ERN, not just ERNI. So the first thing I would say is that every ERN is different. What I say that relates to ERNI may not be exactly applied to other ERNs. So if you're a new EPAG or considering becoming an EPAG member of an ERN, get to know and understand your own EPAG really well. What are the unique problems that your ERN faces? Because it's different for each ERN. It partly depends on where they have come from. What are the objectives and priorities of your particular ERN? Again, in theory, all ERNs are pointing in the same direction and we want to achieve the same objectives. But, you know, they all start from a different point in the journey. And as a result, some ERNs will focus much more strongly in one area and other ERNs will focus more strongly in another. You need to understand the focus of your ERN that you get involved in, but also why that is a particular focus for your ERN. Because if you speak with an EPAG colleague from working in another ERN, they may have a different idea on the direction. There are good reasons for these differences. And then finally, on knowing your ERN, spread the word, because even in so-called advanced countries like France, which probably is the most advanced in terms of developing rare disease programs, plans, and expertise, many people, many important people, clinicians, researchers, still don't really know about ERNs, and even fewer really understand about ERNs. So part of the role of an EPAG member is to make sure that we help people to understand what ERNs are for and to spread the word. It's important. Next slide, please. So the second point I would say is that know the members of your ERN. All ERNs are collections of individuals. The key is in the word network. And so inevitably they all differ quite dramatically as a result of the individuals that make up that network. As an EPAG member, it's really important you try to get to know the individuals who are within the network and try to be useful to them. The more they see you as being useful rather than decorative, the more they will take you into their confidence and join with you. But it isn't just the ones who are speaking the most. And I'm guilty of this, actually. When Petia introduced me as one of the most involved, that means one of the noisiest and the one who speaks too much. But remember the quiet members of the network as well. When you have a lot of people together, and in our meetings, we can have 60, 70, 80 people there. It's impossible for everyone to speak publicly. But everyone that is in that meeting is an expert themselves, and all of them deserve your respect and attention. And I would really urge you to try and get to know all of the members as far as you possibly can, because some of these people will move into more prominence as the work flows. And then also you have to remember that EPAG members are not just there to represent their own disease and that disease only. You need to make an effort to learn as much as you can about the other diseases that are included in your ERN. The patients who have those conditions but don't have a representative dedicated, an ERNI, for example, with 900 diseases, it's clearly impossible for the patient representation in all of those. We are there to represent those patients as well as our own disease areas. And again, this comes back to this point about getting to know some of the more quiet members of the ERN, because they can help you to understand and help fill some of the gaps in knowledge about the other diseases. Next slide. So you have to know, previous one. You have to know the network well in order to function well. You have to know the other clinicians, but you also need to know yourself and make a kind of skills audit of what you know. You're there first and foremost because of your relationship with the patient groups and your knowledge of a particular disease. And this has a value to the ERN, but I think we have a duty to try to give more value than just having that knowledge when it's called for. You almost certainly know much more than you think you do. When we go into a meeting, we always, and especially a meeting with so many experts with such huge experience, it's easy to feel daunted and to think, wow, what can I say that these people don't already know? But don't be intimidated by the huge intellect that you have in front of you. Try and develop the confidence to work alongside them as peers, not just as junior members of the team. We have more to do than just helping to get the coffee. And don't forget the skills that you bring from outside medicine. Most ERN clinicians and researchers, the clinician members, they've spent their entire careers in one sector, which is healthcare. Sorry, just a moment, let me get rid of that. They spend their entire careers in a single sector, and people who are patients who have experience of other sectors can actually bring some of that experience to play and help to develop the strategy of the sector. So you need to first of all understand it yourself, but then try to make sure that the team that are managing the ERN are aware of that experience and they have the opportunity to draw on it. And then last slide, please. So no one likes the people who constantly put their hand up just because they want to hear their own voice. But equally, if you don't ever speak at a meeting, you will be invisible. And you really have to ask yourself the point that apart from gaining knowledge by being there, what are you actually contributing? And we actually are not there in an ERN setting to gain knowledge, although of course we do that in huge quantity. We are there to contribute. And in order to contribute, from time to time, we need to speak up. Not always in public. Sometimes, believe it or not, I don't ask a question that I want the answer to, because I think perhaps it's just for me. And so I'll go and speak to the speaker later on and ask that question privately. So a good rule of thumb for me before asking a question publicly is to try and think to myself, is this a question that's just for me or my disease, or is this a question that would actually be interesting to other people in the room? And if you think it's of interest to others, it's a pretty good indication. It's a good idea to speak openly and publicly. There isn't a hard and fast rule about this. Inevitably, you'll get it wrong sometimes. Believe it or not, I live in fear of speaking too much and people groaning when I speak up and thinking, oh my God, here he goes again, another question from this same guy. But if I feel the question is important, I have to do it, even if I think people will groan. And I urge everybody to think along the same lines. And I think we have a great chance to contribute in a big way to our ERNs. Thank you.
Thank you so much, Russell. Thank you so much. Everybody has there are also two more people who are going to say some words and to present also themselves. It's Professor Cherninkova, the head of the newly endorsed LHON center in Bulgaria. Also, in her staff is Professor Ivailo Turnev. I don't see him today, but Professor Ivailo Turnev is leading two expert centers, full member of ERNs, of two ERNs. He's member since 2017 of the Neuro ERN, ERN Neuro for neurological diseases, where Holm Grisna is the head of this network, and also he's full member of the Meta ERN. So we are really pretty lucky that we have somebody who is quite well acquainted with the ERNs, who is part now of this very newly endorsed by the government LHON center. But Professor Cherninkova, are you here, Silvia?
Yes, okay.
Yeah.
Hello, my name is Silvia Cherninkova. I'm a neuro-ophthalmologist, and now I want to talk something about the expert center on Leber's hereditary optic neuropathy, which is newly discovered in Bulgaria right now. Because everything, all activities of this center will happen in the future, in the near future. All tasks before the center will happen in the future. You know that Leber's hereditary optic neuropathy is rare maternally inherited disease caused by 3 most common mutations. These are G1177A, G34360A, and T14484C. This is the most common mutations causing the Leber's hereditary optic neuropathy. And these mutations leads to dysfunction and apoptosis of retinal ganglion cells because there is a dysfunction of complex 1 of the mitochondrial respiratory chain. This is a mitochondrial disease, you know, of course. And this apoptosis and of retinal ganglion cells leads to visual loss. We have in our center, the main task of this center is to follow up the patients with Leber's hereditary optic neuropathy. In last years, we diagnosed 22 patients with Leber's hereditary optic neuropathy. These are 17 males and 5 females. You know that males have a bigger risk to develop the disease than female because of maybe probable protective role of the female sex hormones. This is the one of probable explanation of this different risk of development of the disease in the carrier of the mitochondrial DNA mutations, encoding these subunits of complex 1 in the mitochondrial respiratory disease. Our patient, the main task of our expert center is to follow up these patients regularly every 6 months and to give this data to a national register for patients with rare eye diseases and publicly, of course. A very important task is to regularly follow up these patients with eventual treatment opportunities in near future, because you know that there is an antioxidant agent which is approved in about 20 countries in Europe. It's reimbursed in Europe, in many countries in Europe. This is idebenone. The other, there are promising results from the experimental gene therapy, which is not yet approved in Europe. And now, these our patients have the three most common mutations. I talk about these mutations, most common mutations, but we found other less common mutations in our Bulgarian patients. One of our families have digenic inheritance with two mutations in the mitochondrial genome. This is these two mutations. This is G1177A and T14484C mutations. This digenic inheritance is not so. It's rare, of course, but it's not so. It is described in the literature, of course. And these patients with this digenic inheritance have moderately reduced visual acuity. We think that it is a result of maybe very early onset of the disease in the member of this family, that they have the onset of the disease in age about 3-4 years. And the other explanation, probable explanation, this moderately impaired visual function in these three members of this family is these mutations T14484, which modifies the effect of mutation G1177A, which is associated with the most severe phenotype, with most severe visual impaired functions. And we found very rare mutations, which is not typical in another family, Bulgarian family, with 5 affected members. We found very interesting rare mutations for European population. This is the mutations G3635A mutations, which is not typical for European families, but it's found, it's described in families with Chinese origin or Siberian families. In our families, Bulgaria is of Bulgarian ethnicity. We found a very interesting new pathologic variant of mitochondrial DNA mutations in a gene MTTP, which is not yet described in the literature in one of our patients. And our patients will be followed up their visual functions in the future every 6 months. The other very important task before our expert center is to provide the patients early to help the doctors, the ophthalmologists, neurologists, and general practitioners in the country to refer these patients suspicious of having Leber hereditary optic neuropathy to our expert center for early diagnosis and early genetics testing confirming the disease because of these eventual treatment options. It is popularization of the disease is very important because Leber hereditary optic neuropathy is a rare disease. It is not well known in Bulgaria, and sometimes the ophthalmologists, neurologists think about different diseases. They think about optic neuritis sometimes with demyelinating etiology or inflammatory etiology, and this leads to delayed diagnosis in many patients. Most of our patients diagnosed in our group of expert group in Alexandrovska Hospital, Medical University of Sofia, most patients are referred very late, after several months or even years after the acute stage of the disease. And this delayed diagnosis is this early diagnosis is very important because of these treatment options, but delayed diagnosis is found in our hospitals and among our doctors, ophthalmologists, neurologists, and different other tasks is to help this patient with their social activities, to provide them sometimes low vision aids, to provide them psychological help, and different other activities which are difficult for them because of their visual loss. I want to tell something about our investigation, our good collaboration with geneticists in Bulgaria, like Professor Radka, who is the head of Department of Molecular Medicine in Medical University of Sofia, and Professor Albena Todorova, who is the head of Medical Diagnostic Genetic Laboratory Genica. And this good collaboration, we had this collaboration many years ago. Over 20 years ago, we made and performed in Bulgaria the first clinical genetic analysis in patients with inherited retinal dystrophies. We have international project with British ophthalmologists and geneticists like Professor Cherninkova from Institute of Ophthalmology and Moorfields Hospital in London, UK. And we performed terrain investigation of patients with suspicious of having retinitis pigmentosa in Roma families, in big Roma families, with the patient, over 20 patients in each of these families. We found interesting and genetically proved these families with inherited retinal dystrophy. One of these families is with autosomal dominant retinitis pigmentosa. The other big family with Roma ethnicity was with X-linked retinitis pigmentosa. We found very different phenotypic characteristics of the disease in these two big families. We know that in X-linked retinitis pigmentosa is associated with the most severe phenotype with very severely damaged visual functions. All of them are almost blind with practical blindness. Patients, the patients with from the other family with autosomal dominant retinitis pigmentosa have different phenotype with less severely damaged visual functions, with moderately reduced visual functions and parametric changes. And this was the first clinical genetic analysis and phenotype and genotypic correlation in patients with retinitis pigmentosa in Bulgaria. And everything will be happening in the future, and because our expert center now in Leber's hereditary optic neuropathy was right now discovered.
Thank you very much.
If you have any questions, concerning our patients,
thank you very much. Since actually the time thank you very much. Since the time is advancing, I'll give now the floor to Professor Kaneva, who is actually in charge, also somebody who will be together with the EPACs in charge of the ERNs implementation, and at the same time she's somebody who is also very well acquainted with the European ecosystem about rare diseases. She's the reference center for Bulgaria of BBM ERIC. She's also the coordinator for the 1 million genome project, and the ophthalmogenetics in Bulgaria are situated in her department. Also Professor Todorova from Genica, she's also here, but actually Professor Kaneva, the floor is yours, and also the practical question to Hélène and to Dorothée, how and who from Bulgaria could join the ERNA as a supporting partner. Professor
Thank you.
Kaneva, the floor is yours.
Thank you, Petia. Thank you everybody for this fantastic opportunity to get acquainted with the work of ERNI. And as you already heard, we are working in the field of ophthalmogenetics with Professor Cherninkova and Professor Ivailo Trnev for more than 20 years for research on mainly hereditary retinal diseases and congenital glaucoma. But we also working for the diagnostics of rare eye disorders. As Petia already introduced me, I'm the head of Molecular Medicine Center, that is research infrastructure, the main national research infrastructure in the field of genetics and genomics in Bulgaria. And we have the facilities for genetic and genomic sequencing these days, the NGS sequencing, for exome and genome sequencing as well. But since 2016, in the Molecular Medicine Center, the Diagnostic Laboratory of Genome Diagnostics was established, and we are offering since then genetic diagnostics for all rare diseases actually in Bulgaria. This is the supported by the Ministry of Health for the reagents and by the National Health Insurance Fund for children with rare diseases and families with rare diseases. However, for all patients that are grown-ups over 18 years old, nobody is reimbursing the cost of the genetic tests in Bulgaria, so they must pay out of their pockets for this diagnosis. And that is actually the result of the policy in the rare diseases in Bulgaria. Since 10 years, we don't have national program. We used to have national program on rare disorders till 2013. And now the situation is much worse than before, unfortunately. And because of this, we are really struggling with the clinicians working in ophthalmology to secure the genetic diagnostics for the patients with rare eye diseases in our country. We're in very good collaborations with the clinics of ophthalmology and neurology in the biggest hospital in the Medical University of Sofia Alexandrovska Hospital, and Professor Silvia Cherninkova and Professor Oscar and their teams are actually referring patients as well as clinicians from all over the country for genetic diagnostics in our diagnostic laboratory. As Petia mentioned, I'm also the national coordinator for the National Hub for Biobanking, which is part of the BBMRI ERIC, the European Infrastructure for Biobanking. And because of this, I get, and our center get involved also in the big initiatives related to 1+ million genomes in Europe, as well as the genome of Europe and the genetic, building up of the infrastructure for genetic research, sharing genome data. This is the GDI project. So our center is a member of the GDI project. And we are currently, I hope today is the day for the submission of the next big project that our center is going to participate in. This is the Rare Disease Partnership. And in this partnership, we are going to participate in the clinical research network with the undiagnosed cases in our center. And I'm really happy that not only Medical University of Sofia is going to participate, but also we managed to provide the participation of the National Science Fund, supported by the Ministry of Education and Health. And hopefully, when this project is funded, we will be able to have funding for the next 7 years for research projects in rare diseases, including rare eye disorders. And the third partner in the from Bulgaria in this partnership is, I'm really happy that Petia and the Rare Disease Bulgaria as patients organization is also going to participate in this European, huge European initiative. Medical University Center is also participating in one other directly related to the ERNs project, and this is the Jardin project, which is just beginning, as you know. We managed to join the project in the very last minute, and we are representing the Medical University of Sofia is representing the Ministry of Health, because in our university, actually in the hospitals are based 5 of the 7 national expert centers that are members of the ERN network. So I hope that through this project and the initiatives, we will be really able to find our national way to integrate the work of these ERNs in the national healthcare system, because this is the huge problem in Bulgaria so far, and not only in Bulgaria, I guess, but so far the existing centers participated in the network, the European network, but got no support from the government, and that is making the everyday life of these centers and the clinicians there really, really difficult. So we have quite a long way to go. And we would be really happy if we could join the ERNI in some way, because we understand very well the procedures are quite difficult, and the national system for approving the expert centers is very tedious and long, and actually it's not helping. It's preventing clinicians to establish such centers. So in this regard, I really have to admit that it's a huge success that Professor Cherninkova, after 7 years, she has been able to to get through this barrier and to have the LHON center established as the first one of the first centers, expert centers related to rare eye diseases. And with this, I think the time is running. But if you think we may have some couple of more minutes, I would like to introduce actually our expert in ophthalmogenetics, Kunka Kamenarova. She has just a couple of slides to show you the results of our diagnostic work. It is actually our pride. I must say that the genetic diagnostics of eye disorders is with the highest yield in our diagnostic laboratory. And this is, of course, related to the very good clinical description and the referral of the clinicians to our laboratory, but also to the skills of our well-established already clinical genetic specialist. Dr. Kunka Kamenarova has been the postdoc of Professor Shami Bhattacharya and has been trained in London and then later in Kabimer. So she's actually the central person in our genetic laboratory related to eye disorders. Kunka?
What I would just say is that when I listen to you, I think you have all the ingredients to be a very active member of ERNs and ERNI in particular. Now, as you know, we are not the ones who are deciding. There are rules, and there are also the national, as you just mentioned, the national organization that the member state has to take the decision. Without the approval of the member state, we cannot have a center of that member state. So this is highly, highly important. And of course, then we have criteria that we can adapt to states that are maybe less prone to rare diseases. But anyway, we have also to the Commission, we have to deliver memberships, I mean the approval to the memberships according to criteria. But when I listen to you, I believe you have done a lot. You're already very much involved in all the European activities around rare diseases. So I don't see why, on my point of view, we would be eager to have you as a member. But there are steps that are obligatory and that we cannot do on your behalf. This is especially on the national
endorsement.
Yeah, this is something, and I know this is a problem, and really, if we can help by any way, we can do, but we will never take the national decision, of course.
Yeah. Once, if possible, of course, this potential opportunity for being a supporting partner. Some area, because actually,
in fact, we will wait to see if there is I mean, for being a supporting or invited partner, we can do this, and I think Dorothée will be able to discuss on this. I'm really sorry because I have messages I have to join. But being a supporting partner, this is probably highly possible. Now, being affiliated or a member, then we have to wait for a new call. But definitely. Supporting it can be easy. Much more easier.
Dorothée, you are probably still here. Actually,
I am.
It will be, since actually Dorothée here is mainly in charge in our case, and she has joined also for now the meeting due to the governance reasons. If there will be some question addressed to her with regards to the opportunity for supporting partnerships, please feel free to ask. That's only what we
Yeah,
can
don't
do.
hesitate to write to me if you have additional questions even after this meeting, or write to Petia as well, because she will transfer for sure the question. Of course, as Hélène said, we are totally dependent on the Commission for the two major status, full members and affiliated partners. But now we have the supporting partner, less official status, but it's a good way to enter to the network and wait for the call, even for affiliated membership or for full membership.
Yeah, thank you. It's actually something what we see. We had in June a roundtable with the participation of Matt Johnson. We had actually two roundtables. The first one was only with the heads of the expert centers, members of ERNs in Bulgaria, and also some other expert centers dedicated exactly to the possible calls from the side of the European Commission, what could be advocated. Especially there were questions with regards to the so-called underrepresented country. This is a terminology used now by the European Radius Partnership, where Bulgaria is going to this number of countries which are so-called underrepresented countries, where actually even the ERNs are not so good promoted to these countries. And we had also a roundtable only with politicians, with the participation of the advisor of Ministry of Health and some deputy from the Bulgarian Parliament, where Matt has also addressed the challenges coming, not the challenge, but the status quo coming from the European Commission dedicated to the goals, for what could be advocated, with whom, what should Bulgaria do in terms of the board of member states, if a potential call only for affiliated members only from the underrepresented countries could be created. But all of that are theories, opportunities, they're absolutely not a fact. What we see currently after also these meetings had with Matt and here with the societies and let's say the authorities, is that the current opportunities are related to so-called supporting partnerships for what actually will come to you, Dorothée. If there are any other questions in terms of governance, things are formal, but these formal things are actually preventing bad practices. Often we see people who call themselves experts, and they, in order to be expert, there should be also some other, not only expertise, but what we have spoken today about these registries, data sharing, access to treatment, relations, the patient journey to the low vision centers. All of this is supposed to be, well, quite known and approved in front of the authorities in order to be an expert, designated expert center locally. So even with the patient representatives, we are advocating for the good practices that exist also in Bulgaria. There are expert centers which can really prove exactly that. And also in other countries. We had last week a roundtable, Dorothée, with Marko Hulina from Slovenia, who has exactly presented his Center for Rare Diseases, the way the patient journey is built from starting from the reference to the genetic testing, counseling, all of the diagnosis pathway, afterwards the access to clinical trials, to the low vision center, and the opportunities related to the low vision rehabilitation. It is a long way which actually Bulgaria is supposed to go. But at the same time, we have, in order to grow to this point, we have this opportunity, and I'll personally be very thankful to you if we find a way as a minimum to step into the ERNI as a supporting partner, and especially if those who are already eligible, meaning the LH1 center and the genetic facility, which is embedded in the European ecosystem. That's from my side.
May I ask something, Dorothée?
Yes, please.
I wonder what are the requirements, the legal requirements for the organization that is performing a supporting partner? Should it be the hospital? Can it be another legal body? What is the status?
For supporting partners, we have to have some very dedicated figures, but you have to be in a hospital to have a certain amount of patients per year, and starting to have all the requirements that are required for all memberships. Of course, you won't have the audits, etc., because it's organized by the Commission, and we can't afford that. But I will put the major criteria on the website. We are redoing our website currently, so it's not done. But to ensure that in the process to be an affiliated partner or a full member, you already have these important criteria. For example, it's patient security, patient information, all the equipment for the facilities, I mean, in the hospital. If you have emergency services in the hospital, etc. It's really related to patient safety. So in their vast majority in Europe, the hospitals have and comply with these criteria because it's really the good practices. Of course, not everywhere. Private hospitals, for example, not always comply with this criteria. So it's one major point. I don't know in Bulgaria how it is. But yes, I can do a summary of that. But we discussed that during a coordinating committee a few weeks ago. We have to comply with some of these criteria because we can't accept everybody even as a supporting partner. The thing is the level of the number of patients you can see then can be low in comparison with full membership and affiliated. But even affiliated partners, for example, it's not the same level than full membership.
Yeah,
and that's why some countries decided only to have affiliated partners. Yeah. It's important. I insist on that. But the choice of full membership or affiliated partners is totally up to your country, your ministry, in fact.
Yes.
They will decide if their center in their country will be full members or affiliated partners. And in one country for one ERN, I'm very clear, it's one country, one ERN, you can't have both. If for this disease, you can have full members, you will have only full members. If you can have only affiliated partners, you will have only affiliated partners. Because it's really a decision up to your Ministry of Health, in fact. Supporting partners, of course, because it's our decision, it's quite different. But if you choose to go for an official membership, it's really up to your Ministry of Health. And I really think right now you can start the discussion with your Ministry of Health, because sometimes it takes years. Sometimes it's easy, and in Bulgaria, some of your hospitals are already members of some ERNs, so they are aware of that. So I think you can start the discussion with your Ministry of Health for rare eye diseases.
Okay, thank you.
Be ready for the next call.
For next call. Thank you. Thank you.
But anyway, let's see whether, let's say, especially with regards to the genetics working group, if the the Medical University of Sofia and the hospital, actually, especially now with this center could be somehow related to the supporting partner. Otherwise, the country will not progress in terms of registry and data sharing in the future. So let's see. If there are not any other questions, are there some other questions, so we could close the meeting?
Hi, Petia. I actually have a question, if I may. It's Irina.
It's Irina. It's from the patient advocate, Dr. Irina Stratieva. She's an IRD patient, but she's involved in clinical trials.
Yes, thank you. Hi, everyone, and thank you for the presentations. They were really helpful. I actually have a question, if it's possible for the patient group, actually, a patient group as us, also to designate and support the application of a center.
Excuse me?
Is it possible for the patient group also to designate and support the application of a center?
Yes, I just answered by chat. In fact, yes,
okay.
It's important to have patient support, and in fact, it's required.
Okay.
In the official documents and in the official codes, it's mandatory to have the support of local patient groups. In fact, it's a security to ensure that the center is. Because you can demonstrate that, of course, it's patient-centered, the care, etc. But if you have the support of the patients, it's a proof.
Okay, thank you.
Thank you so much. Thank you very, very much for the time of everybody who has participated today. There will be, I suppose, many other questions which will come, which we could discuss between ourselves, and we'll address them somehow. Not somehow, but anyway, we know already how to. Once we have organized this meeting, it means that we know how to reach each other.
Thank you, Petia, for the efforts, and thank you, Dorothée, as well for the great opportunity to talk to you directly.
Thank you, and thank you for this opportunity as well. And do not hesitate to write to us in case of any question. We are there for that.
Thank you so much.
Thank you very much.
Thank you very much. Thank you. Bye.
Thank you. Bye-bye.
Bye-bye. See you soon.
Bye.